I've got a guest joining us today, John Sotirkys from now Peer Recovery.
Yes,
Oh,
Peer Recovery Center.
Okay, Peer Recovery Center. I just want to make sure. Okay, I'm never sure. Okay, so we're talking about a special program that's starting this summer. Let's talk about that. And by the way, before we begin, tell us about Peer Recovery. I apologize.
So Peer Recovery Center is it's a center in Morehead City where it is peer run. So peer support specialists who are in recovery.
Okay.
You know, about 2 years into their recovery, they've gone through the state certification to become peer support specialists, and they're able to provide substance use and mental health peer navigation.
Basically, people who've walked who've been through the process,
Correct.
who've walked the walk, who know what it is to have challenges, addictive challenges, right?
Yes.
All right, and we're talking addiction of every nature, including alcoholism,
Any substance.
any substance. Okay, all right. So you've got a program coming up this summer, and this, by the way, we're going to be talking at great length about this today, and a new program. What's the name of the program?
So the program's called Peers on the Beach, and this was designed as an anti-stigma campaign.
Ah,
So what we'll be doing is throughout the summer, and our kickoff is the 28th at Atlantic Beach, but throughout the summer, peers will be going out every week to different locations, and they're going to be providing resources. They'll be providing materials. They'll give the option of being able to talk to anyone.
okay. Let's talk here about the issue of stigma. The individual who is suffering from an addiction, or possibly their family members.
Correct.
Both, in other words.
Yeah, it would affect all of that.
Okay. Where are you going to do this? Where physically? Where is this going to happen?
So the kickoff event is going to be at Atlantic Beach on June 28th from 10 to 2.
We're talking 10 days from now.
Correct.
Okay. That's the reason we're promoting this here on the air. We're going to be doing some more conversations. I just want to warn you. John and I have talked on great lengths about the whole issue of substance abuse. And by the way, the assumption is drugs, but alcohol too.
Absolutely.
Okay. And so the program is designed, it's called Peers on the Beach. And it's PEERS, not PIERS, like
right.
Yeah, Peers on the Beach. And what time frame are we talking about, both in time of year, how many months, weeks, what period of time, and what time of day too?
So this program in itself is going to be running through Labor Day across the beaches in Carteret and Carteret County for right now, and then we're hoping to expand as the years progress. So we'll have about 15 peers that'll be out there, and they'll be out there on weekends, and they'll be able to share their stories, be able to talk to anyone, even if a family member has someone they want to talk to and get resources for.
Okay. So I'm walking along the beach. How do I identify you?
So we're all going to have teal-colored shirts.
Okay.
All the peers will have...
That's kind of a blue-green.
Correct, yes. So it's the same...
I have to know what a teal is, but anyhow, that's fine, yeah.
The same main color of the Hope Mission logo.
Okay. Will there be a name on it?
There will be. So we'll have our... We recently are going through a rebranding. So we're changing Hope Mission of Carteret County to Hope Mission of Coastal Carolina. So it'll be the new logo that's on those shirts. And
that would lead me down a rabbit hole we don't want to go down right now.
We can talk another time.
No, congratulations.
Yeah, it's awesome what's happening.
Interestingly enough, there's a lot that sort of initiates out of this area, and this is just another example. All right. But continuing on. All right, so is it going to be just on the weekends?
As of right now, yeah, we're looking at Friday and Saturdays, tentatively.
How easy has it been to find the peers? And by the way, let me just remind everyone here what we're doing. This is we're talking with John Sotirkys of, again, Peer Recovery Homes.
Yes.
And it's an organization in Carteret County. How is it funded?
So we are funded primarily through grants.
Okay. And what's the avenue to get to you? Is it coming through, for example, the county health department, or is it coming directly through, well, for example, Hope Mission? We talked about that organization. How is it being funneled, or directly to the Peer Recovery Home?
So anyone can come into our Peer Recovery Center at
Okay.
3900 Bridges Street.
Which is right next door to the health department.
Correct.
Yeah.
If they want to get into our substance use rehabilitation homes, they can come in and fill out an application at Peer, talk to one of the peers, and then talk to the leadership of Hope Recovery Homes. They'll do an intake and an interview, and then we could bring them in. And so that the process is fairly
All right. And that,
easy.
But this program is grant funded. All right. Let's talk about Peers on the Beach. How is that funded? Through the same process?
Correct. The peers on the beach are funded through state grants.
Okay. Now, how unique is this program?
It's non-existent here.
Okay, but does it exist anyplace else?
I've seen it exist in one other location on the west side of the state.
Okay.
That they're called Sunshine Foundation.
Okay.
And they do it out there. They call it mobile recovery or something like that. But
All right.
but this was tied into what the peers are also doing with recovery on the road. So that's another program the peers are doing every Wednesday. They're going to different counties and they're providing mental health and recovery classes.
You bring up another topic, and we're going to be talking about this a little later on in the program. I just want to say at the very opening here, I shouldn't say at the opening, I've been talking now for a few minutes. We're talking about Peers on the Beach. It's a program that's starting June 28th.
Correct.
In 10 days. It's going through Labor Day. It's going to be weekend predominantly at this point. And it's an opportunity, and we'll talk about where on the beach in just a moment. We're talking with John Sotirkys of Peer Recovery. And later on in the program, I just want to say we're going to have, we've got some guests joining us. We have the Secretary of the North Carolina Secretary of Health and Human Services, Kody Kinsley, and Dr. Michelle Law. Am I correct? They're going to be joining us by phone. And so let's talk here for a moment, and we'll talk about the impacts of mental health, because I think that plays a role in this. At least that's my expectation. But before we even get into that, we're talking peers on the beach. You said at the outset to address the issue of stigma, not necessarily substance abuse, but stigma.
Right.
So, am I just hear from you that is probably the first barrier?
Absolutely, yes.
Oh, you don't want to equivocate on that.
Well, no, I'd love to. So,
but I mean, when I say you're not questioning that, it is absolute in your opinion.
Yes, it is absolutely.
Why?
When you think of an addict or an alcoholic, and you don't think, if it's something you're not empathetic to, or you don't have that experience of, it's easy to leave it outside of your vision, right?
Okay.
Because you don't live it, you don't have a family member that's in it, you yourself weren't in it, so it's easy to not acknowledge. But when you see that person, you don't think of them necessarily as, this is a successful person, this is someone that's pursuing a master's degree in human services, or this is someone who's taken their lived experience and are now investing into hundreds of people's lives throughout the year and saying, this is what worked for me, this is what can work for you.
Okay, but stigma, I've always thought of stigma from the perspective of the family members, that I don't want anybody to know that my child or my grandchild or my brother or my sister or myself even, that I'm addicted.
Absolutely.
But I have to break through that stigma of and accept the fact that I have this problem.
Right.
Or that my loved one has this problem.
And I don't think that it is something to be ashamed of. I think it's something that if you need help, there's help there. And you have people who are who will go out of their way to go and meet with you where you're at, to be able to provide some sort of help.
We're talking with John Sotirkys again. We're talking about Peers on the Beach, taking place June 28th, starting okay. What's going to take place on June 28th? What actually is there an event, activity? What?
So we're going to have a kickoff on the 28th where we'll have Secretary Kinsley and some other staff members from Department of Health and Human Services.
DHHS,
yes.
yeah.
We'll have Jennifer Mead. She'll be there. She's part of their community involvement or community engagement. And then we'll have Dr. Michelle Laws that'll be there, and she's with Symbiotic Strategies, and she was the one that helped bring this connection between us and DHHS. And then we'll have another one or two people from DHHS that'll be coming to speak.
All right. Before we take the break, I'm curious, and this is a question, of course, I'm going to be asking here a little later on as well. We've sort of thrown some questions at our guests that will be joining us by phone here in a few moments. How serious is the addiction issue right now, just in Carteret County?
Enough to where that health department designed their own post-overdose response team. That response team's going out and responding with 911 calls for overdoses. So it's not every county utilizes them, but it's significant enough to where we would warrant a team like that.
Do you see it increasing during the summer months? Well, let me put it this way: the individuals who have addiction, do we see more of them in the summer months? I'm assuming because of the ocean and the beaches and waterways that we're an attractive location, so we may see more instances of that. Is that?
I think you'll see more instances of substance use, not necessarily anyone. Typically, you see the holidays as where the time where that tends to go up. Summertime, I think it's hard to say when is a good time for someone that has an addiction to start using.
Okay. We're talking with John Sotirkys. He was here in the studio earlier about the program Peers on the Beach. And by the way, it's Peers. I got to keep up with the number of E's I use. Peers on the Beach. And we're talking about an event that's going to be taking place June 28th, just 10 days from now. Before we get our guest on, we've got North Carolina Secretary of Department of Health and Human Services, Kody Kinsley, with us here. But before I introduce him, just remind folks, if you will, John, what the program is.
The program's called Peers on the Beach, and it's an anti-stigma campaign that will be running through the summertime.
Okay, and it's for those who are suffering from substance abuse. And when we say substance abuse, including alcoholism.
Correct.
Or, and maybe coffeeism.
Oh, I don't know.
Oh, okay. All right. We've got Kody Kinsley joining us. He's Secretary of Department of Health and Human Services with North Carolina. And I discovered a few moments ago that he's never seen a real beach, having come from Wilmington. And with that, Secretary, good afternoon. Thanks for joining us.
Oh, gosh, my mother. She's going to be so mad at you, Lockwood.
All right. So you're from Wilmington, North Carolina. Are we sure that's in North Carolina? I thought it was in South. Anyhow, I like to give folks from Wilmington a hard time. But welcome to the program, Secretary. Appreciate your time very much. So
great to be here.
Let's talk here for a moment about the whole issue of substance abuse and what the Department of Health and Human Services sees in North Carolina. How significant is this issue? And in light of that, is it a problem that is growing at a steady pace? And I say growing, but a problem that's becoming apparent at a steady pace or possibly accelerating. But with that, welcome, and thanks for your time.
Well, thanks so much. It's great to be here. And look, I think every family in North Carolina knows that the opioid epidemic, which has been pivoting now more to fentanyl, is really an epidemic of an issue. It is rapidly growing. We were making some significant progress, and then as we saw the drug shifting into fentanyl. It's become even harder to manage in a very, very small dose. It can be deadly, and so it really takes an all-hands-on approach, and that's been a big priority for us at the department, investing considerable resources in prevention in the first place, and then treatment to try to help tackle this addiction issue.
You know, before you joined us, as a matter of fact, before the program actually began, it's sort of the first 5 minutes of a conversation with my producer, Ross, behind the wall, window, and board. The conversation came up with a story that I read earlier today in the Washington Post about Surgeon General, expressing concerns about social media and the impact of social media on children. And I would contend, arguably, the impact of social media on all demographics, children, young adults as well as older adults. I think there's a significant problem here, and I am curious. This leads to another question about an issue of mental health. But are there any, if you will, on-ramps to addiction that we don't see as the normal expectations? For example, attending, going to the bar and drinking, getting your first drink, or having your first marijuana joint, or something of this nature. Are there other trigger efforts, other trigger figures of events, such as social media? Does that play any role in this? We won't belabor that. I'm just curious.
Well, I think the way to think about it is, first, there are, people have different genetic disposition to addiction, right? Some people can, use a variety of different substances or do a variety of different activities and not develop addictive behavior. Others can do those exact same things and yet develop an addictive behavior. And you can develop addictive behaviors to a number of things, whether that's social media issues or things where there's actual chemical dependency where you can develop an addiction. It's obviously easier to develop an addiction to something that has a chemical attachment to it. The other piece of this puzzle, aside of kind of a genetic disposition, is that people often use different substances as coping mechanisms towards stress, right? This is where mental health and substance use disorder are so deeply linked. And when people are stressed, we want to encourage folks to get outside, to go for a run, to go for a walk, to pick up the phone and call a friend and do healthy coping mechanisms. But during the pandemic, when people were really stressed, we saw a 40% increase in alcohol sales, and that was when the bars were closed.
Right.
And so that's an unhealthy coping mechanism that can help give more opportunity for those addictions to blossom.
It's a good point. Again, and you're just hearing a conversation with our guest this afternoon. He is the Secretary of North Carolina's Department of Health and Human Services, Kody Kinsley. Very interesting observation that alcohol sales increased and the bars were closed. It doesn't take much of an assumption there to determine what was really happening. With that, and you touch on another issue, and I think this is, John, I'm going to go to you on this one in a moment. With peers on the beach, you said the stigma. Another issue of stigma, we've talked about this in relationship to veterans, and that is, and I'd love to get your opinions, plural, on this one, and I'm going to go to you first on this one, John. Sometimes substance, let me throw this one out as just a thought or a thesis. Substance abuse is an indicator of possibly mental health issues. Yes or no? And is that one of the major contributing factors?
I think it can be. With the veteran community, the stigma, and we've talked about this before with homeless vets and mental health, and I think it can be. How dare you call me having a mental health issue? Right. I agree. And it can, a lot of times I see veterans that use substances to coping with their mental health. Correct.
Secretary Kinsley, the issue of mental health, is that something that is sort of seen as a sort of a good starting point on the whole issue of substance abuse? Would that, if we could find those pathways to help people who probably deny that they have any struggles, is that something that would contribute to a decline possibly in the issue of substance abuse, in your opinion?
I think the way to think about it is that all health is really connected. We see that people who have unmanaged mental health issues, they also have more expensive chronic diseases. They struggle with diabetes and heart disease and other things in the chronic disease space when they have unmanaged mental health issues. You can't carve the mind out of the body. These things are deeply interconnected. So, yes, we see often that people with substance use disorder can have co-occurring mental health issues of a variety of levels and acuity, and so that's why we really have to treat whole people. And a lot of times, all these things, 80% of what drives health is: do you have access to food? Do you have access to transportation?
Mm-hmm.
Are you safe? And do you have a job? Those are our key drivers of health. And when you don't have those things, then all the other indicators start to fall apart. And that's why we have to kind of go back to the big picture, always treat the whole person and try to help them across the board. And another example is someone with substance use disorders probably developed bad dental hygiene.
Right.
And that can create other problems down the road. It can also be really hard to maintain work. So these things are all very interlinked. But I do want to go back to something you and John were talking about around stigma. I mean, this is so important. We don't stigmatize people with diabetes when they're struggling. My grandmother has diabetes. When she slips up and wants to, quote, 2 extra scoops of strawberry ice cream, we don't call her a moral failure, right?
Right.
And that's, we've got to think about substance use disorder as an addiction. People crave it like they crave air, and we need to support them with all the tools necessary and not stigmatize them.
Excellent point. Or people who have heart conditions, high blood pressure, or cholesterol. We don't stigmatize that.
Right.
That's right. We
very,
don't
very interesting
take
point.
away the meds.
Okay, that's a very interesting point. All right, we're talking with, again, North Carolina Secretary of Department of Health and Human Services, Kody Kinsley, and we've also got John Sotirkys here in the studio. The whole issue of stigma, okay, well, I'll acknowledge that my wife has a heart condition, but I have a drug addiction, whatever it is, alcoholism, what have you. I don't mind talking about her, but don't talk about me. Is that what will be happening on Piers on the Beach, John?
Well, we'll be able to offer not the solution, but we'll be able to offer a solution while we're out there. People that they can talk
it's
to.
It's breaking down barriers, isn't it?
Correct. And not just that, is they'll be able to, even if they don't want to talk to someone right then and there, they'll be able to utilize the Peer Warm Line.
Okay, what's that? So
the Peer Warm Line was started, I think it was this year that it went into effect, February of this year. And it's throughout the entire state, and it's a warm line that anyone can...
Spell the word.
P-E-E-R.
No, but warm, is it warm?
Warm.
W-A-R-M.
M,
as in warmth. Okay.
Mm-hmm.
I'm sorry, as opposed to warm line. Okay.
Yes, and anyone can call that wants to talk to a peer that has any questions. So it may not be necessarily at that moment. They may not feel the desire to talk at that moment, but they'll be given resources to call that line if they want to.
But it also, will this not help? Because quite often, for example, walking up and down the beach, you see people in 2s and 3s. Someone might say, hey, I know that Lockwood has got a problem, but I don't know how to approach it with him. They walk over to you, one of your peers, and say, hey, I got a friend I'm kind of worried about. I'll be given some information about how to help me.
Mm-hmm.
Is that what
even help them how to address
it? Yeah. Okay. Again, Secretary of Health and Human Services with us, Department of Health and Human Services, Kody Kinsley. The topic, Secretary of stigma. To that point, might it be worth our while to initiate some sort of, if you will, I hate to use the word promotional campaign, but we'll use that for the moment, educational campaign to, and I'm going to point to myself on this one, by the way. So often I said drug addiction was not an illness. It was a decision. It was a choice. I have since, after having done a series of interviews, we did about 2 months worth of weekly interviews, Secretary, with the Carteret County Sheriff, who's been very aggressive on treating the cause of incarceration, not just those who are incarcerated, but he sees the problem. And as a matter of fact, it's a little frustrating to him because he, in an odd sort of way, he's running a halfway house or a form of a medical facility, and the jails are not designed for that, and so he's had to accommodate that. But the fact that we have this vision, this stigma, is that one of the great barriers that you see as the Secretary of Department of Health and Human Services?
Oh, absolutely. And look, I want to thank you for spending the time to, have this conversation on the show and for working with law enforcement. I'm so grateful to our law enforcement leaders across the state. I hear from many of them often, that they feel like they're never going to be able to arrest their way out of this problem. And,
right.
That's where, 60% of people in jails or prisons have a substance use disorder. Mm-hmm. These systems and the stigma around the systems are deeply intertwined. So, it takes these conversations. We do fund media campaigns that try to normalize mental health and getting treatment for mental health, particularly focused on youth. Mm-hmm. We know that's been a big area for folks kind of feeling okay about having that conversation. And then, one of the big programs that we're wanting everybody to know about is 988. 988 is our easy to remember suicide prevention lifeline. And in the last 12 months, we've had 100,000 callers in North Carolina, or callers or texters that connected with 988 who needed someone to talk to at a really critical crisis moment. These are great programs that not only give people a place to go and the support they need, but the awareness of them, starts to normalize these issues just like any other health issue, and we start to break down stigma one story at a time.
Again, that's North Carolina's Secretary of Health and Human Services, Kody Kinsley, with us this afternoon. We're going to be letting him go here in a moment. I know he has other commitments, but I think this is an important story. Now, Secretary, you're going to be here June 28th for the, quote, ribbon cutting for Peers on the Beach. We'll use that term, John. Where will it be taking place?
We'll be at Atlantic Beach.
Atlantic Beach, mm-hmm. Okay. And, Secretary, the efforts such as this, as John shared with us a little earlier, he knows of only one other similar program that's in Asheville. Now, you may know of others, but programs of this nature, are they relatively, shall we say, cutting edge?
Well, I'm really excited about Peers for a lot of reasons. First, like you and John were talking about earlier, when someone is in a crisis point in their life, or they're struggling with addiction or any other complex mental health issue, sometimes the best person to talk to is someone who has walked that walk mm-hmm. before themselves. And we see in the evidence that, in those tough spots when someone is misused and, overdosed, or, they're at the hospital, the person who has been in that spot before, approaching them to say, hey, here's what happened to me and here's the path forward, that engenders trust, and that can be a game changer for folks to be on the path of recovery. Peers are incredibly successful. And we've got a lot of people who need behavioral health support in North Carolina, and, therapists and psychiatrists and all these
right.
folks are really hard to meet. Peers we can get more of faster. So we're really investing in Peers. I'm proud of John and the work that Peers at the Beach is doing. He mentioned the Peer Warm Line. It's a new program that we've launched so that anybody can pick up the phone and call the Peer Warm Line 24/7. And then, we've been funding other programs across the state, peer living rooms, mm-hmm. peer waiting rooms in hospitals, peers that help support in harm reduction sites. They're really the secret sauce for us supporting folks with behavioral health needs throughout the state.
Okay, and the second word I'm going to take away from this conversation, not only stigma, but I thought the word trust. you've got to earn the trust of the individual in order to gain kind of an intro and with those folks. Secretary, I know that you have other commitments. I want to thank you for your time. Secretary of Health and Human Services Kody Kinsley with us this afternoon. And I'm looking forward, I'm just going to go ahead and blindside you. I'm looking forward to another conversation here, probably on or around the 28th. And I'll just mention that to John, and I'll make him, I'll hold him accountable for this. But I want to
look forward to it. Thank you so much, Lockwood.